Thank you, everyone, for joining today's webinar titled Best Practices for Keeping Childcare Settings Health and Safety Safe During the Pandemic. Today, we focus on safer disinfectant use. We're so glad you could join us. I'm Perry Sheffield. I'll be moderating the presentation today. I'm a pediatrician and environmental health researcher and faculty at the Icahn School of Medicine at Mount Sinai in New York City, and I co-direct the New York State Children's Environmental Health Centers Network and the Region 2 Pediatric Environmental Health Specialty Units. And we serve New Jersey, New York, Puerto Rico, and the Virgin Islands. This webinar today is co-hosted by the Children's Environmental Health Network, CEHN, and the Pediatric Environmental Health Specialty Units, known as the PEHSUs. And it's funded in part by the Agency for Toxic Substances and Disease Registry, ATSDR. We're excited to see the large volume of registrants. We have over 4,000 people registered for today's webinar, and currently the numbers are rising, but we have hundreds who have already turned in. We're well over 600 at this point. This webinar is applicable to both family and center-based childcare settings. The second webinar will take place a week from today, next Thursday, March 18th at 1 p.m. Eastern Time, and it will address improving ventilation in early childhood education settings. And will be presented by Marian Heyman from the Connecticut Department of Public Health. Our partner organizations for on this webinar today are the National Association for Regulatory Administration, the Association for Early Learning Lenders, and the National Association for Family Childcare. I have a few housekeeping rules to go over before we begin. Today's presentation will be recorded and it will be available on the websites of CEHN and the PEHSU, as well as the slides, will also be available on those websites. A certificate of attendance will be sent via email after today's presentation to those who are here for the live event. Today's presentation will be about 45 minutes long, and we'll respond to questions in the last 15 minutes following those presentations. You can type your questions at any time into the chat box or the Q&A box that you should be able to see on the right side of your screen or down at the base. Please keep in mind that today's webinar is interactive. A computer screen is needed to view the presentation. And also note that there may be delays when advancing the slides due to varying internet connection speeds. So now I have the pleasure of introducing today's presenters, Dr. Vickie Leonard and Bobbie Rose. Dr. Leonard directs the Improving Environmental Health in Early Care and Education project at the Western States PEHSU at the University of California, San Francisco. Ms. Rose is the program director and a child care health consultant at the California Childcare Health Program, CCHP, at the UCSF School of Nursing. The presenters from today, as well as Marian Heyman, who will present on next week's webinar, as I mentioned, will be available during the Q&A portion today. With that, I'll pass it over to Dr. Leonard.
Thanks for this opportunity to talk about ways to reduce the spread of the COVID pandemic in childcare programs. So as Perry said, I work with the Western States Pediatric Environmental Health Specialty Unit, which is a network of PEHSUs across North America dedicated to providing expertise on the connection between reproductive and children's health and the environment. And we are funded by ATSDR and the EPA. So I've had a long-standing interest in these issues going back to my time when I actually worked with the California Childcare Health Program. And I subsequently co-authored a publication called the Green Cleaning, Sanitizing, and Disinfecting Toolkit for Early Care and Education, which some of you may be familiar with. And we have funding from ATSDR to update the toolkit, and it will be available on our website. Actually, the curriculum part of the toolkit will be available next week. So I encourage you all to visit the Improving Environmental Health in Early Care and Education page and look at the new materials that have updates that are COVID specific. So how do we best protect children and staff in childcare facilities from SARS-CoV-2? In the beginning of the pandemic, early research suggested that the virus that causes COVID could survive for days on surfaces. And this research was widely quoted in the media, and use of disinfectants increased widely. We now know that while bits of the RNA from the virus may be found on surfaces for days or longer, that these bits are not sufficient to cause disease. And unfortunately, efforts to reduce the risk of transmission of SARS-CoV-2, the virus that causes COVID-19, continue to focus on disinfection. Today, we'll talk about safer products and processes for disinfection, but first I would like to situate these disinfection practices within an overall strategy called the layered approach to reducing the risk of transmission. This approach reflects the current science and properly situates disinfection in the overall hierarchy of our efforts to reduce transmission of the disease. It also more appropriately directs our energies towards diluting or removing the virus from the air, which is more likely to be the source of infection. The SARS-CoV-2, the virus that causes COVID-19, is transmitted primarily in droplets and aerosols. Droplets are heavier and fall to the ground. Aerosols are lighter and can travel in air farther and last in the air longer than droplets. So efforts to make ECE facilities safer from transmission of SARS-CoV-2 should be focused primarily on reducing virus in the air. So this layered risk reduction approach has been shown to lead to a 95% reduction in risk of transmission of the virus that causes COVID-19. It also results in decreased use of and exposure to harmful chemicals for indiscriminate disinfection of surfaces. So these are the elements of the layered risk reduction approach, reducing the source of the virus, requiring masks, social distancing, ventilation, filtration, disinfection, and education. Most of these strategies for reducing sources of the SARS-CoV-2 virus are well known. Vaccination is especially important right now because we are in a race to reduce cases of COVID-19 before new variants overtake our vaccination efforts. These new variants require less virus to make us ill, so we are at higher risk of transmission now with these new variants. So these strategies are not new. These are images from New York City in the early 1900s when they were experiencing an outbreak of tuberculosis. And this actually was very effective. Children stayed warm in wearable blankets known as Eskimo sitting bags and with heated soapstones placed at their feet. The experiment was a success by nearly every measure. None of the children got sick. So the first element in the, or one of the elements, is requiring masks. Wearing a mask will 10 times more aerosols are produced when speaking than when just breathing, and 50 times more are created when you're shouting or singing, which is why these activities should be discouraged even with a mask. Most children as young as 2 can be taught to wear a mask, and no masks should be put on children younger than 2. Surgical masks are more available now, providing more protection to the wearer. And research shows that cloth masks with 3 layers are best. Mediocre cloth masks reduce the risk of spreading the virus by a sick person by 30%. And they reduce the dose to the receiver of those viruses by 30%. So together, the mask-wearing infected person and their uninfected neighbor accomplish a 50 to 70% dose reduction when they both wear their mediocre cloth masks. If the masks are better fitting and better quality with 3 layers, there is an 80 to 90% reduction in the inhalation dose of the airborne virus delivered to the vulnerable neighbor of a sick teacher or child. So just wearing masks can accomplish quite a lot. So social distancing, we're quite familiar with this. Younger children have trouble with social distancing, but are also less likely to transmit the virus that causes COVID-19. This image shows that the social distancing prevents infection from droplets and reduces, but does not eliminate risk from infection by aerosol. So the figure on the right is going to be infected by aerosols, not by droplets, whereas the two people on the left having a conversation within 6 feet of each other are at risk of being infected by droplets. Droplets are particles of saliva or respiratory fluid greater than 100 microns that are expelled from an infected person when they cough, sneeze, and talk. People are infected by these droplets flying onto the mucous membranes of the nose, mouth, and eyes of someone close by. The droplets fall quickly to the ground thanks to gravity. So infection from droplets can occur inside or outside. Large droplets are not inhaled. Immediately after they're released, the liquid content starts to evaporate, and some droplets become so small that they are transported by airflow rather than gravity, and these are aerosols. Aerosols linger longer in the air, they can travel longer distances, and they infect by being inhaled through the nose or mouth, and sometimes by falling on the eyes. And infection by aerosols is more likely in enclosed spaces with inadequate ventilation. So building ventilation can be as effective as public health interventions in reducing risk of transmission. It's an important way to remove particles from the air. And I'm not going to talk about all the ins and outs of ventilation, because next week Marion Heyman is going to go into great detail on ventilation and filtration. So this is an interesting slide. It shows the effectiveness of the layered approach in reducing the risk of infection from airborne virus. No one part of this approach can by itself significantly reduce risk except going outside, which is the minute bar at the far right of the graph. But when all these things are implemented together, they accomplish a 95% reduction in risk. This is indicated by the vertical blue line second from the right. There is a small additional reduction in risk from hand washing and surface disinfection. And I want to remind people that if you touch a surface with infectious virus, if you don't touch your face and you wash your hands, you won't be infected. So this is another reason for wearing masks and also for hand washing. So I just want to say again that we can't disinfect our way out of the COVID-19 pandemic. New research shows little transmission occurs from surfaces. It's not a zero risk, but it's a much lower risk than we initially thought. And this quote is from a researcher looking at all of the research on transmission. And he says, in my opinion, the chance of transmission through inanimate surfaces is very small, and only in instances where an infected person coughs or sneezes on the surface and someone else touches that surface soon after the cough or sneeze within an hour or two. I believe fomites that have not been in contact with an infected person for many hours do not pose a measurable risk of transmission in non-hospital settings. A more balanced perspective is needed to curb excesses that become counterproductive. And these excesses are evident in the sales of disinfectants. One company has seen a 100% increase in sales during 2020. And indiscriminate use of disinfectants can cause health effects. Frequent users have increased risk of chronic obstructive pulmonary disease, asthma, and eye irritation, and other health problems. The other problem is disinfectant residues left on a surface can become airborne and then inhaled. These inhaled particles contribute to poor indoor air quality, affecting those with asthma and allergies, and the residues contain chemicals that can cause cancer, eye and skin irritation, central nervous system impairment, and children are particularly affected by ingesting these residues in dust. The particles get into the dust, children put their hands on the floor, put their hands in their mouths, and they've ingested it. And there are animal studies showing some of these disinfectants can impact reproductive health as well. Not only do these disinfectants have an impact on human health, but they also affect the environment. For example, half of all the disinfectants on EPA's List N, which is the list of disinfectants believed to be effective against SARS-CoV-2, were quaternary ammonium compounds last June. And these compounds are released during manufacture and after use into surface waters, where they break down slowly and are toxic to aquatic organisms. So what is the role of disinfection in reducing the transmission of SARS-CoV-2? Well, this may not be the last pandemic that we encounter in our lives. Surface disinfection may be a more necessary strategy in the next pandemic. We also have outbreaks of infectious disease that require stepped-up cleaning, sanitizing, and disinfection. So knowing how to choose safer products and practices is important. Before Bobbie talks about how to choose and use disinfectants, I'm going to briefly review some new technologies that may provide alternatives to chemical disinfectants or alternative application methods of chemical disinfectants. Many of these technologies are being marketed heavily to schools and childcare centers, so it's important to know about them and how they do or don't work. First, it's important to know about the regulatory differences between chemical disinfectants and devices. The EPA cannot confirm whether or under what circumstances such products might be effective against SARS-CoV-2, the virus that causes COVID. These devices are regulated in that false or misleading claims can't be made about the effectiveness or safety of the devices by the manufacturer. These devices, the EPA provides establishment numbers for these devices rather than a registration number, which comes with a chemical disinfectant. So I want to reiterate that the EPA does not verify the disinfection claims of device manufacturers. If you decide to use a device that makes disinfection claims, you'll need to review the manufacturer's efficacy data and decide whether the device will work for your purposes. So which methods should you choose? So the old method that we all are familiar with of applying disinfectant using a microfiber cloth, sponge, mop, or auto scrubber. These are the safest ways to apply disinfectants. They produce the least aerosolized particles in the air. When you aerosolize particles, you breathe them and they react with other chemicals in the air, and we end up with the unintended chemical consequences, which have not been adequately studied. These particles land on surfaces where they dry, and then again they flake off into dust. If you're using disinfecting wipes, you have to make sure that the surface remains glistening wet for the required contact time. And if not, then you have to reapply. If you're applying directly on the surface with a mechanical spray device, this is slightly less safe because you're breathing in the aerosolized particles in the spray. You also get bounce back when you spray hard surfaces, increasing exposure of the person applying the product. So now I'm going to talk about these new devices, and the first one is an electrostatic sprayer, which applies a positive charge to disinfectants as they pass through a sprayer nozzle. These charged particles repel one another, look for neutral surfaces which they stick to and wrap around to coat all the sides. So they provide a more uniform coating of disinfectant on sprayed objects. If you choose to use an electrostatic sprayer, you must use only list end products approved for use with electrostatic sprayers. Verify this on the product label and follow specific application instructions, including required contact times and personal protective equipment, which industrial hygienists recommend quite extensive PPE when you're doing this. So some of the issues with these sprayers: many of the disinfectants used with them are quats, which irritate the lungs and are linked to reproductive harm in animals. You still have to clean surfaces. This is often overlooked when describing the advantages. The room has to be empty, and it's not clear how long the disinfectant remains in the air. This depends on how many air changes per hour your ventilation system can achieve. The other problem is that spraying is often indiscriminate. They spray everything, including children's backpacks, furniture, etc. So there's application of disinfectant to surfaces that shouldn't be disinfected. There's also a question as to whether enough disinfectant is applied to achieve the required contact time. And I've talked about quats and dust. The final thing is that we don't know what the unintended consequences are of sending an electric current through liquid antimicrobial disinfectants and then spraying indoor environments. I invoke the precautionary principle, and so until we have more research and know for sure what these effects are, we should be careful. The next device are these devices that produce electrolyzed water on site. They use pre-measured packets of reagents that makes a solution, and the active ingredients of electrolyzed water is hypochlorous acid, often hyped as a safer alternative to bleach. Hypochlorous acid is a potent disinfectant, and concerns raised by scientists in the field are that hazardous byproducts are produced in chemical reactions with hypochlorous. Hypochlorous can evaporate out of a solution and exist as a gas, and it's as a gas that it poses problems. Many gaseous hypochlorous molecules indoors will find gaseous ammonia molecules to react with that are naturally in our environment, forming compounds called chloramines, which are actually the chemicals that smell like bleach and are bad for our health. We need to do a lot more research on this topic because not enough is known about these common household chemicals. What we do know gives us cause for concern and suggests we should invoke the precautionary principle and limit our exposure. Foggers and misters depend on gravity to deliver disinfectant to surfaces, and they should never be used. Surfaces still, again, have to be pre-cleaned, and delivery to surfaces may be uneven, and contact time, and therefore disinfection, may not be achieved. And they invite, again, indiscriminate use of disinfectants indoors on surfaces that don't need disinfecting. So you're using more disinfectant product, and the associated health risks are greater. They pose health risks to the applicator, and they don't accomplish, frankly, anything that you can accomplish by using conventional application methods. The other thing is that they can cause permanent damage to electronic equipment, and they can also I forgot my point. Sorry. Aqueous ozone is another technology that's been introduced. Ozone is infused in water. It's a very effective cleaner, and it destroys microorganisms. Some make disinfecting claims, others just claim to be sanitizers. These devices claim effectiveness against a large number of bacteria and viruses. But in some device tests, they don't kill SARS-CoV-2. The other problem is that aqueous ozone breaks, it's not a problem, it breaks down into oxygen and water, leaving no residue and does not have to be rinsed. Ozone in its gaseous form, though, is very toxic to humans. And we don't want to spray aqueous ozone in the air because some of it will become gaseous. And the effects of gaseous ozone include respiratory symptoms, reduced lung function, and airway inflammation. Gaseous ozone also reacts with other chemicals in our environment, for instance, to create products like formaldehyde. And people with asthma are especially susceptible to gaseous ozone exposure. So dry steam vapor technology is one device that seems quite effective and has few health outcomes. The unfortunate thing is that it's still very expensive. The other problem with devices is that none of them technically meet many state licensing requirements. The ECE facility use a hospital-grade disinfectant because they are not a chemical disinfectant. Again, the EPA registers but does not evaluate the effectiveness of devices marketed as effective for disinfecting. And research shows that microfiber and steam were as effective as a disinfectant at controlling an outbreak of norovirus. These devices kill things in seconds. Okay, I think I'm out of time, so I'm not. UV light is an interesting technology. It's proposed for both air and surfaces, but most people do not recommend use of UV light devices at this time for ECE. The technology is just not, it's neither affordable nor does it accomplish anything that you can accomplish with ventilation and filtration. So that's the end of my presentation.
Thank you, Dr. Leonard. And now we're just passing to Bobbie Rose.
Thank you. I'm just waiting for my slides to come up, but while I'm waiting for that, I just want to say thanks, Vickie. I always learn something new from your presentations, and it's always a pleasure to present with you. And I'd like to thank the organizers of this event. I'm really happy to be here today and have the opportunity. And thank you all for being here as well. So again, I'm still waiting for my slides to come up. Still see Vickie's.
Bobbie, if you go to the, it says viewing one, if you click on the arrow, you can click on yours to view two.
View. Okay. Got it. All right. Thank you. It's good to have friends. Okay, so let's jump in. So we're going to move into talking about cleaning, sanitizing, and disinfecting, and just safe practices, effective practices, and how to choose safer products. Our ultimate goal is to protect the health of children, staff, and the environment. We want to keep illnesses from spreading. We want to do all of this safely and effectively. And we'd like to adopt an integrated approach that we look at all the different ways of managing germs in a way that's healthy for children, staff, and the environment. So just a little background here. Infectious illnesses are caused by what we call germs. So those are also called pathogens or microbes, things like viruses, bacteria, fungi, parasites. Germs can get into our bodies, multiply. That's what makes us have symptoms and makes us sick. Infectious illnesses are also called communicable illnesses, contagious, spreading illnesses. We know that infectious illnesses can spread from one person to another before their signs or symptoms even appear, and that people can pass germs without having symptoms of illness at all and continue to spread them once they have gone. We also know that childcare settings are unique. Okay, so children spread germs easily when they're together in groups. And this happens by breathing germs that are in the air, by touching other people and surfaces with germs, by eating or drinking something with germs. Studies show that young children in childcare centers have more respiratory illness, ear infections, and diarrhea than those who are cared for at home. The good news is this doesn't necessarily affect their learning, but we do know that children get sick a lot, especially in childcare. So as Vickie mentioned, there are lots of ways that we can stop the spread of infectious illnesses, and we want to use that layered approach so that all these different strategies work together. So things like vaccination, personal hygiene, especially hand washing, staying home when ill, physically distancing, wearing face masks, safe food handling, ventilation and air cleaning, which will be discussed in more detail next week. And of course, what we're talking about right now, cleaning, sanitizing, and disinfecting. So I guess, again, it's just one of the many strategies. So what's the difference between cleaning, sanitizing, and disinfecting? This might be a review. But when we clean, we're just physically removing dirt, debris, and sticky films by washing, wiping, and rinsing. Just soap and water, detergent and water. Sanitizing is actually killing germs. So we're using something to kill germs to a level that will reduce the risk of becoming ill. And disinfecting is a higher level of germ killing, and it means to kill nearly all of the germs on hard, non-porous surfaces. So why do we clean? There's lots of good reasons to clean. So a clean environment has fewer germs that cause illnesses. Also fewer allergens. So you can clean up the dust, food residue, grass, mold. It doesn't attract pests. Reduces the risk of exposure to lead dust, pesticides, or other toxins. There's better air quality. There are mental health effects for children, families, and staff, and generally it's just more attractive for your community. There are some tools for effective cleaning. But first of all, always get rid of clutter. Make sure that toys, materials, and equipment are neatly on shelves or closets so that you can clean more easily. Microfiber cloths and mops work well to trap and absorb dirt, oils, germs, debris from surfaces. They dry quickly and use less cleaning solution. Walk-off mats placed at doors and in entryways capture dirt so it doesn't get into your facility in the first place. And a HEPA filter vacuum cleaner will remove more dirt, dust, dander, allergens, etc. than conventional vacuum cleaners. So that is a good investment. Cleaning products that are healthier for people and the environment. So let's think for a minute about choosing products. So the next step is to think about what's a safer product. Many products might have strong fumes or try to mask odors with perfume, and that can lead to poor air quality. Some products make claims that they're green, but they may not be. So you want to be very careful when you're looking for your cleaning products. So choose something that's fragrance-free, free of dyes, non-antibacterial, non-aerosol, or a shortcut is just to look for a third-party certification, and that will be from UL Eco Logo, Green Seal, or EPA's Safer Choice. So just to be intentional about what you're choosing. And remember that children are more vulnerable to the exposure to chemicals because they're growing and developing. They explore with their mouths. They put their hands in their mouths a lot. Their little bodies have a harder time breaking down toxic. They breathe twice as much per body weight as adults. They have softer, more absorbent skin and smaller airways. They spend more time on the ground. So there's lots of reasons to be attentive to what you're choosing to clean. So what surfaces should be cleaned? Toys, bedding, floors, clothing, cribs, cots, mats, play equipment, refrigerators. These surfaces generally can just be cleaned, and always clean before applying a sanitizer or a disinfectant. One of the key messages that I'd like to bring forth today is just to use the right tool for the job. This is a cute little video from the California Department of Pesticide Regulation that just sort of explains how you don't want to overdo it by using the wrong tool for the job. So make sure that you are paying attention to that. So let's talk a minute about antimicrobial pesticides. So this term is a term that is used by the EPA, but sanitizers and disinfectants are antimicrobial pesticides, and they are widely used in childcare settings. Antimicrobial pesticides are used to destroy or suppress the growth of harmful microorganisms and on inanimate objects and surfaces. So this is an EPA definition, and EPA is in charge of regulating antimicrobial pesticides. So now what sanitizers and disinfectants are what we're going to talk about next. So why do we sanitize? So again, sanitizers are going to kill germs to a level that reduces the risk of becoming ill from contact with the surface. Sanitizers are mainly used for food preparation surfaces and appliances, kitchen countertops, eating utensils and dishes, high chair trays, tables for eating, plastic toys for the mouth. So again, sort of food-oriented, food-adjacent sort of surfaces and things that might be placed in the mouth. Okay, so why do we disinfect then? Again, this is the higher level of germ killing. So we're going to use disinfectants on surfaces that might be soiled with blood or body fluids. We're going to use them on door and cabinet handles because they are high touch surfaces, meaning that they are touched by a lot of people, and toileting and diapering areas. So diaper changing tables, potty chairs, hand washing sinks, toilets, things in the bathroom. So now let's think about what products we're going to use for sanitizing and disinfecting. So first of all, you want to make sure that you are choosing a product that has an EPA registration number on it. That means that it is registered with the EPA and is an antimicrobial product. Just a little warning, this will be on the label. You'll be able to find it, but it's very small. So you might need to reach for a pair of reading glasses. Okay, so also another thing to look for on the label of the product is the signal word. So this will give you an idea of sort of how strong or how hazardous this product might be. So moving from caution to warning to danger, caution, the signal word of caution will be less hazardous, and danger will be potentially more hazardous. The label is the law. Always follow the instructions on the label for sanitizing and disinfecting. Things that will be on the label are things like, do you need to mix it with water and how much? How long must the product be on the surface? Is it okay to use the product on food surfaces, or do you need to rinse it off? These are just examples of direction for use on the labels. And you can see I have circled here the dwell times for sanitizing differ from disinfecting, also there's information about rinsing with water. Now let's talk a little bit about the design for the environment program. So if you see this label on a product, you will know that it's the least hazardous active ingredient and a least hazardous product. This is a program of the US EPA, and this is the only program that can set the standard for evaluating antimicrobials. These are the ingredients that are known to be less hazardous on the left here. And so those are going to be safer if you look for the active ingredient, safer for your setting. The ingredients will be on the label. Again, I keep going back to the label. You'll see the one on the right has hydrogen peroxide, and the one on the left is actually a quaternary ammonium. Sodium hypochlorite or bleach and quaternary ammoniums are commonly used, but I will say these are not the safer choices. And again, this information will be on the label. And the reason that they're not the safer choices is that they have, they can be potentially asthmagens, and also can adversely affect the skin. So now we move on to COVID-19. So which disinfectants are going to kill COVID-19? That's really what people want to know right now during the pandemic. And luckily, we have a tool on the EPA website for List N, called the List N tool for COVID-19, and it will help you choose. And you can choose by active ingredient, or you can choose by dwell time, or the EPA registration number. I'm just going to bring up a couple of them so that you can see how the tool works. So I chose the first one, citric acid, as the active ingredient. And interestingly, on the right, it brings up all this other information, including what the contact time is, and that might help you make your choice. The next one on the list of safer active ingredients is hydrogen peroxide. And when I bring this up on this List N tool, I can see that there are actually 82 products that meet this criteria, and those are the dwell times too. You can see there's really a range, like 1 minute, 2 minutes, 10 minutes, and that will help you decide which product to use, because you might want to think about what surface that you are actually using for. If you go to the Design for the Environment website, you will see this handy little box on the bottom that does a little cross-reference for disinfectants that can be used against SARS-CoV-2. And those will be actually the safest and most effective products that you can use. And there are, I think, 11 products that show up at that point. So I would direct you toward that if you are in the process of choosing a safe and effective product right now. Many of you might be familiar with this table from Caring for Our Children. This is really a good reference for routine cleaning, sanitizing, and disinfecting. And also note that you might need to take a look at your licensing regulations to make sure everything you're doing squares away with what you need to do for licensing. Always use caution with sanitizers and disinfectants. There's a whole list of things here that will be most likely on the label, and there are different purchasing options you can use for dilution systems. That's another thing you can look into. What about bleach? It is commonly used. If you are using bleach, please be very careful and use it appropriately. Bleach has a short shelf life. It needs to be mixed with water daily. And laundry bleach is not the one you want to use. You need to check to make sure it's a disinfecting bleach and it has an EPA registration number. But again, please use caution, because it can irritate the skin and eyes, trigger asthma, affect breathing, and there are safer choices. If you're using bleach, again, all of these things will be on the label, and never ever mix ammonia or vinegar with bleach. And what about using vinegar or lemon juice? I have to say this comes up in every workshop, and I just want to say, if your goal is to reliably disinfect your child care facility, then no, you can't. You need, the safer choice is to use an EPA registered disinfectant and use it according to the label instructions, and take measures to choose a safer product. These are just some nice posters that I recommend. They're available in English, Spanish, and Chinese, with just step-by-step cleaning and disinfecting and sanitizing for childcare programs that we did in partnership with the California Department of Pesticide Regulation. And that brings me up to our time for this content. And I want to thank you again, and I think we move into questions now.
Thank you, Bobbie and Vickie. And yes, again, this is Perry Sheffield. I'm serving as the moderator today for our Q&A. We had lots of questions coming in, as well as comments, and some people feeling like there's a lot of information at once. And so I just want to reassure you all that there will be follow-up. The slides and some other helpful resources will be emailed out next week. And then the slides and today's recorded presentation will be available in a few weeks, and a link will go out at that time as well. So again, if you have questions, feel free to put them in the Q&A and or the chat, and we will try to get to all of those. So a couple that have come in already. Some of them have been questions about protocols around masking, particularly whether or not the guidance for children over 2 is that children need to wear masks at all time. So just clarifying on that, as well as employees who have previously had the virus. So staff at, the question is specific to Head Start actually. So employees who have had the virus, are they also expected to continue to wear a mask?
Well, I would say yes, that medical scientists are saying that they don't know if you've had the virus, whether you continue to be immune to it, and for how long. And in fact, it's really recommended that everyone, including people who've had COVID-19, get vaccinated. So until people are vaccinated, I would say yes, they should wear masks. And I think for children, children are quite resilient, and I have my granddaughter is too, and she quite willingly wears her mask when she's out and about with other people. So I think yes, and the numbers of children being infected by SARS-CoV-2, actually just this week they were saying that the downward trend has stopped. So kids do get COVID-19. They get it much less readily than adults, but they do get it. So I think the best practice right now is for everybody to wear a mask.
Yes, I would agree with that. We will be wearing our masks for a while, even as more people get vaccinated. So just finding a mask that's comfortable and breathable, and that you'll wear, and helping children do the same is really going to be key to moving on from the pandemic.
And there's a question I see about children ages 1 to 2. Those children do not wear masks. So masks are recommended for children 2 and up, and below 2, no masks.
Thank you. We also just had a question from someone asking to review the definitions. I know cleaning, sanitizing, and disinfecting have very specific definitions. Would you mind just reiterating for the group the difference between those?
Sure. So cleaning is the most basic. It's just using soap and water to remove anything that might be on the surface, any dirt, any debris, anything that's sticky, lingering around. And then once something is clean, you can do the added step of killing germs, right? So that's when the sanitizer and disinfectant is used. And sanitizing kills germs to a level of reducing the risk of illness, where it's thought to be safe. And disinfecting is a little more, so a little stronger, usually a longer contact time. And that means that you're killing nearly all the germs on a surface. And the difference between sanitizing and disinfecting for childcare purposes really has mostly to do with what surfaces you are going to be using that on. I hope that answers your question.
Thanks. And yes, I think that the simple definitions that were provided were, at least the person who wrote in the question said appreciated those and wanted to write them down. So again, those slides will be sent out next week. And I also saw a question about a certificate that will also be sent to those who attended the live, this live webinar. So you will be receiving a certificate. There was a question, there have been a couple of questions about, let's see, there's a question about air purifiers. Are those okay to use?
Yes, they're great. And I didn't touch. They're part of the layered approach, along with ventilation and filtration, which air cleaners do. And I didn't talk about them because I know Marion's going to go into great detail on those next week. But yes, they're an important part. And I just want to say that there's a lot of money apparently in the new relief bill that was passed by Congress. And my feeling is that if one good thing comes out of this pandemic, it's that we will more fully appreciate the importance of ventilation and filtration and keeping our kids safe inside buildings, particularly in childcare where they're all grouped together in fairly large numbers compared to at home. This has really been neglected for years, and it's a huge issue. So I hope everyone really uses their funds to improve the ventilation and filtration of the air in their programs.
And I'll just add that next week, I'm actually going to spend a lot of time talking about portable air cleaners, and teaching you how to choose one that is the right one for you. So tune in, and if you can't tune in, the information will be available because it'll be recorded. So that will be available for you to use. Thank you.
Thanks, Mary. So again, that webinar will be the same time next week on March 18th. There's a couple questions about just reiterating that how often should we disinfect in centers? Do you review that?
That's a good question, and I would like to say that the best practices for cleaning, sanitizing, and disinfecting from caring for our children have been in place for a long time, and they are still good. So if that's what you've been doing, you are totally on the right track to very solid practices, even during the pandemic. So again, I would have people refer to Schedule K in caring for our children, that it really lists how often things need to be cleaned by surface, by the different surfaces and different objects and different equipment. So just, I would say, our regular practices for cleaning, sanitizing, and disinfecting are what should be done right now, because we know that it's this layered approach that makes a difference. And when we think about intensifying, I think that we need to really look at how the virus spreads, and that is mainly through the air, and understand that those strategies will have the bigger impact on reducing the spread of COVID-19.
Thank you. And thank you for those who are also, I feel like there's crowdsourcing of information too. So I will refer you all to the Q&A, because some people are posting their own, just their own versions. And I think they're helpful to sort of see what people are doing and how they are making sense of this. There's a question specifically, let's see, about quats. I know that you mentioned them. The question was, I think quats are currently being used in the employee bathrooms, I think it said, or staff bathrooms, but it started to erode the handles, and they're looking for an alternative. Can you speak to a safer alternative?
Yeah, so interestingly, if you go to the list N tool and you search for quats, you will find that I think at least half of them, are at least half of all of the products on list N are quats. So that's to say that they're very commonly used, especially wipes. So, but they do leave a residue. They can be corrosive, as can bleach be corrosive. And so what I would suggest choosing is one of, first start with something that has the Design for the Environment logo. That's going to be the safest choice. But you can also go on List N and search search by active ingredient. So something with hydrogen peroxide or citric acid will be a safer choice than something that uses quaternary ammonium for its active ingredient. So it will take a little research. Unfortunately, I can't give you a list because I can't promote individual products. So it will take a little bit of research on your end, but that's where you would start to find a safer product.
And so one of the questions is the official stance to stick with EPA certified products, not homemade?
Yeah. Yeah, you know, can I just jump in about the DFE? I think needs a little clarification. The only certifying agent that can approve safer disinfectants is the EPA's design for the environment. And we will send out a link to that page, which lists the active ingredients that they have approved. And there are about 6 of them, and Bobbie's mentioned some of them, but they include hydrogen peroxide, lactic acid, a couple of alcohols. So that's where I would start. Always start with the DFE page, and then you can take those active ingredients, and if you can't find the products that are on that page, you can go to the list and put the active ingredients in and find products that at least have those safer active ingredients.
Right.
Great. And again, I appreciate the questions that are rolling in. As I said at the beginning, we have a lot of people on the call today. We have over 1,000 with us now. And so I thank you for your patience as we're going through triaging these questions and coming in via chat and Q&A.
I just saw a little question, is hydrogen peroxide a quat? No, it is not.
No, very different.
2 more questions. How long is the bleach and water dilution good once it's mixed? And then another one is, could you just clarify what the K schedule that you mentioned was?
Okay, so the bleach in water, anytime you dilute bleach in water for use, you need to mix it daily. So it will not be considered effective if you mix it in, you use that all week or for 2 weeks. So it needs to be mixed fresh every day. And the second question was, Schedule K, Appendix K. So just a little more on that. I mean, that's from Caring for Our Children, which is a best practice standards for health and safety in childcare settings. That's available on the website, the nrc.org, kids.org. Anyways, if you Google Caring for Our Children, it will come up. And this schedule has been put together in order to help people understand or give advice on how often things need to be cleaned, whether they need to be cleaned, sanitized, or disinfected. And it's excellent guidance. And my only addition to that is that you just need to make sure that those best practices align with your licensing regulations. In California, we have a crosswalk that shows that the Department of Pesticide Regulation has on their website that shows the what's in licensing and what's in Caring for Our Children. But that's going to be different from state to state. Vickie, do you have something to add on that?
No, I think you covered it.
One participant asked, if the greatest threat of spreading SARS-CoV-2 is in the air, it sounds like it makes most sense to purify or filter the air. Is this correct?
Yes, and open windows and take children outside.
Outside.
Yeah, if you schedule times during the day to take kids outside, if you have your HVAC system running and you've got an air filter in the room, if you take kids outside for 20 minutes, you will have completely turned over the air in the room. So you'll come back into a room with no virus.
That's a really powerful statement. Can you just repeat that again?
That if you, Marion will talk about your HVAC systems and your air cleaners, but once you understand how to use those, if they are both functioning the way they should, you can take children outside, and if you've got someone who's infected and there's virus in the room, within 20 to 30 minutes, the whole air in the room will have turned over. So you come back into a room with no virus.
I have to make a little modification to that statement. With the time, concept is absolutely right on. The time depends. And I'll talk about.
Yeah, if you've got optimum equipment.
It depends on what you're using.
Yeah.
That's something that we can, talk about after. But the concept, yes, absolutely, I agree.
Yep. And with our nice springtime weather, spending more time outside is welcome.
Remember those kids on the boat in New York in 1911?
So we're right up at time, and thank you again for our presenters today. And it sounds like it's going to be a great talk next week as well when we delve more into the specifics of ventilation. So thank you again for all of the active participation. And I'm sorry we don't have more time to get to the other questions that were rolling in. There will be resources that are sent out with the slides next week. And again, certificates will be emailed out to those who participated in today's live session. So
And
thank you.
Bobbie and I both have our contact information. So if people have questions, they can also contact us.
Those are on the slides. Yes, thank you. And thank you for your informative talks today.
Thank you. Bye, everybody.
Thank you, everybody. Bye-bye.